afternoon. My name is Kelly Rosetta, and I am the creator and executive director of the Portland-based nonprofit called More Than Lupus. And I'm a patient advocate and an almost 30-year lupus and rheumatoid arthritis survivor. Now, I am beyond thrilled to present this meeting that I'm about to show you. This meeting, entitled AMP Up, which is Autoimmune and Musculoskeletal Patients That Unite for a Purpose, was something that kind of came together in my desire to amplify the patient voice. Now, having had lupus for 30 years now and talking to other people in various autoimmune and musculoskeletal communities that have lived with their illness that long as well, there seems to be a trend to have representatives in the medical community that are not actually living with the illness. Now that could be really frustrating to us as patients, because how is anything ever going to change? How are we ever going to learn? We don't go directly to the patients that are living with this illness day in and day out. So that is where my idea for AMP Up evolved. And I'm so thankful, and you're about to see the presentation here in a few minutes, that I was able to bring together some of the most involved patient advocates, people who are trailblazers, and they are passionate. And one thing that we all truly care about is sharing our story and making sure that the patient voice is up. So without further ado, thank you for joining us, and here is AMP Up. Autoimmune and musculoskeletal patients uniting for a purpose. Good afternoon, and welcome to AMP Up, Autoimmune and Musculoskeletal Patients that Unite with a Purpose. My name is Kelly Rosetta, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And I am a patient advocate, and I am an almost 30-year lupus and RA thriver. And I am beyond thrilled to present this virtual meeting of the minds as we turn the AMP up on the patient voice and hear from trailblazing patient advocates on important topics that they have developed a passion for over their chronic illness journey. Now, every person that you will be hearing from today has lived with an autoimmune or musculoskeletal illness for many years. Their comments and their opinions, though their own, reflect an important message of validation, of healing, and of hope. And our hope is that for those of you who are watching now and are maybe newly diagnosed, for the first time that you feel heard, that you feel seen, and that you feel accepted. So let's raise the roof and let's turn the AMP up on the patient voice. And speaking of powerful patient voices, let me introduce our moderator, Helenas Johnson. Now, Helena is an 18-year veteran of education. She has experience in computing technology and educational services and instructional design. She is a staunch lupus advocate after being diagnosed several years ago and has worked with many prestigious hospitals on overcoming minority challenges in clinical trial participation and increasing quality of life. She is a well-known author and community leader, and her book, The Diary of a Mad Lupus Patient, and her awareness platform, The Lupus Liar, are known nationally for being incredible resources for those in the lupus and autoimmune communities. She is my friend and sister in fighting the good fight. So please welcome Helenas.
Yeah, well, thank you for the invite. What a great introduction. Hello, everybody, and welcome to the AMP Up. We are amping up. I'm very excited for this afternoon. This is a virtual event presented by More Than Lupus, who just introduced me there. More Than Lupus stands for anything, but AMP Up is standing for Autoimmune and Musculoskeletal patients that unite for a purpose. That's what you're going to hear today. My name is Helena Johnson, and I'm excited to be joining you as the moderator for this next hour of discussions and information in the autoimmune community. Okay, for those who are unfamiliar with my work, you've gotten an intro right there from Kelly, which thank you so much, Kelly, for that. But I just wanted to point out there's just so much that we still have to do, and you're going to hear that from our speakers today. I'm excited to have the opportunity to be one of those advocates and a representation of, and I say a representation of because there's just so many of us, and that's why Kelly's throwing this today. I'm just so excited to be one of those that's talking about lupus. Yes, in the minority community, you can see that pretty little dark skin there, but there's so much more when it comes to our ethnicity, our skin, our sex, whether we're female, whether we're male. There's so much, and it's all about us being human and what we're living with and the conditions. But without further delay, and to make sure that our session goes really smooth for this next hour, I am very, very happy to present our first presenter. Our first presenter is Melissa Toller. Melissa, I had a very great opportunity to meet her, but she is an executive director of the Support Fibromyalgia Network, a nonprofit dedicated to fibromyalgia education. I also have fibromyalgia. The education, research, and advocacy of fibromyalgia. She's also a board certified functional medicine health coach. Yes, isn't that awesome? And after spending over 20 years with declining health and no hope, Melissa biohacked, I love this, biohacked herself to a better health. Now she is determined to bring positive changes and create resources that she wished she had for others. So please welcome who's our first presenter, Melissa Toller.
Thank you so much for having me. I am so excited to be here. I'm going to start out by sharing my screen. And today I am going to be speaking on health literacy. So I'm going to start up at the top level, go a little bit granular, but my hope is from this discussion that other patient advocates and other patient-led organizations can continue having this discussion because it's an important thing and it's important for our patient community. So what is health literacy? If you look on the government websites, this is how it is defined. The degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. And when we go through this is really about emphasizing the ability to use your health information rather than understand it. Many of us, if we take in classes with teachers and we've barely passed the classes, we might not understand practical application. But when it comes to our health, we need to know how to implement it in our own healthcare system, and it's super important. So this is the time where we focus on the ability to make well-informed decisions for ourselves and understand how health literacy affects everyone in our community. I'm going to throw a little bit of stats at you too, because 36% of adults in the US have low health literacy with disproportionate rates among people who are eligible for Medicaid. Research also shows that communities with low health literacy experience greater health costs, medical errors, increased illnesses and disability, loss of wages, and compromised public health. So across the board, it's really important that we address these topics as patient advocates. Now, to break it down in more granular level so people understand what the heck I'm talking about on health literacy, because it does get complex, is how well do you understand instructions on prescriptions, appointment slips, directions from providers, interpreting your test results? Now, I know many of us out here are not doctors or we don't have our PhDs, some of us may. So interpreting medical language can be very complicated, but I do encourage everyone out there to at least be knowledgeable about the healthcare results that are relevant to you. So if you're going in to see a specialist related to a thyroid, I would encourage you to understand what results relate to your thyroid and take the time to communicate with your healthcare providers in explaining and how this relates to your overall health, what you should be looking for in lab values, and all the things that we're going to help you in your better experience to move to a healthier state. I hope I can help people feel them a little bit better, is that also studies show that patients forget about 40 to 80% of the information communicated during a doctor's appointment immediately. And then when you go and learn about how they interpreted the information, or if they repeat back to you, it's 50% of the time it's incorrect. That's a huge deal. And those are big numbers to me, and why I find this information really important. And especially those with brain fog like I had, it's important that we take notes and we be the best health advocate for ourselves. And in my healthcare journey, I didn't understand this right away. And even though my mom was coming with me to appointments, because usually at the under age of 18, she was trying to help me. We didn't know as a family what questions to ask, or how, like, it was okay to ask about test results. It was okay to ask about side effects to prescription medications. If I had known that I could ask those questions and asked either the office staff or my providers, I would have had better health outcomes and not just fallen and declined and had so many severe side effects. I didn't keep track of things. I didn't ask for my medical records when I left each office appointment, which is important. One thing I've been trying to learn more about, which probably requires a PhD, is how to navigate the healthcare plan coverage information. I definitely think as patient advocates, we might have to have other patients trained specifically in this area because of its complexity. And remember, as patients, we have rights. And one thing I've noticed that's interesting when you do research on health literacy online, government websites have directed the content to healthcare providers to implement. I think this is an area that needs to change, and there needs to be some more courses directed to patient advocates or people that want to become a patient advocate, or even caregivers. So a lot of the information that I saw is put on providers to do the work. So some of the suggestions were have the patient repeat directions, provide assistance. And I want to ask people out there, how much is this happening in your own care? Have you had that happen to you? That if it is happening, great. But I know that I didn't experience it. So I think there's a lot of changes that can happen. And we need to have these discussions as patient advocates moving forward. We are definitely stronger together. And working together as organizations, leaders, we can definitely do this. And we can't make assumptions that our patient community understands this information. So we have to do better with providing this to them. And that's why I love this conversation right now. Thank you to Kelly from More Than Lupus for hosting this, because strong health literacy enables people to develop the skills and the confidence. We need the confidence to make informed decisions about their own health and the health of your family members too. If you're a caregiver, or you have a child living with conditions like fibromyalgia, we want to be there for you and help you through this path and help you sort out confusion so you can become an active participant in your healthcare. And it's important that you're active, because if you're feeling defeated and confused, you just don't want to deal with it anymore. So we talk about being your best health advocate, and this is what stems in it. You need to understand the information, and you need to understand how to effectively navigate healthcare systems. So that's why I invite everyone to just participate in these conversations, continue it forward. I encourage everyone to create their content and share with their communities. I did put together some tips. It's changed a lot with telehealth in a COVID era. But we always share with people it's okay to ask to bring a trusted family member or friend to your appointments. Again, with the brain fog or maybe some of the insecurity, power in numbers, right? I had my mom come with me early on, and sometimes I felt embarrassed because my mom would ask so many questions. I'm like, Mom, why are you asking so? I was 14, 15 years old. But now I look back at it and it was like, that was really good of her to keep continuing to ask questions of our providers and pushing and learn as much as we possibly could. So I encourage everyone to do that. I did this recently with my father. He actually had some trouble with the telehealth and listening to the doctor on the phone. So we had to adjust his audio equipment, which is actually one of my last tips, adjusted for telehealth, especially this year. Make sure you test those devices ahead of time. We adjusted his audio, but he was still, even though we prepared for the appointment ahead of time, he was still forgetting to ask information. My mom joined him on the call, although afterwards he's like, he told me that he wanted me on the call instead of my mom. So again, find a trusted person to join you that can follow up with questions, can kind of keep track, help you take notes. and just be able to prepare for that ahead of time. You write out your list of questions and concerns. There's so much to this, and I know it feels quick lately with telehealth. So again, just like we were making an in-person appointment, please prepare before and list out some of your questions. And if you feel like you have too many questions, let your doctor know when you start the conversation. Let them know that you have a lot of questions and acknowledge that you may not have enough time to address them, but you're going to start with the most critical things that are important to you. And also, you can always ask your provider if there's someone else in the office, like a nurse practitioner, that you can ask these follow-up questions with after the provider's left. Or if you have medical billing questions, I encourage you to contact one of the staff members. Maybe that they can review it with you. So again, ask questions and be sure to clarify. It's okay to clarify. We need to address or make sure our concerns are addressed. We need to know the follow-up plan. This is very complex, like what's next? So you end the conversation with your provider. Did he prescribe you medications? What do you do if you have side effects? What do you do if you have questions afterwards? Were you referred to a specialist? How long is it going to take for them to refer you to the specialist? And how is the care going to be coordinated? Now, I probably just gave you so many tips to just overwhelm, and I hope I don't overwhelm you. But again, it's like we are all here for you to help answer these questions. And I just appreciate this. I know I packed a lot of information in a short amount of time, but again, I want everyone out there to just be encouraged by this, and let's have active conversations. How can we help our patient communities? So I invite people to just get in touch with me. Yes, this was me before COVID. I hope one day I'll get back to purple hair. But send me an email, melissa@supportfibro.org. I run Support Fibromyalgia Network, so it's a nonprofit. We are going to work on more literature for health literacy. I also became a health coach to bridge the gap between patients and providers. So not only do I talk about lifestyle and nutrition, but a big thing is I bring the patient advocacy to the front. I encourage and empower people to have better conversations with their healthcare providers. So thank you, Kelly, for allowing me to speak today.
That is so awesome, Melissa. I'm loving the purple hair. Just the picture is awesome. And we'll make sure that we have all this information for those who are watching live on Facebook. But there were a couple of folks that were already mentioning, like, this is such a great topic. They were mentioning that one sharer mentioned that they felt that it was important that a doctor had a patient advocate on site. And you mentioned that. And another one had a great question about, do you have any websites or places and other information where they can go and find out more information besides following you, of course, and getting that great information? Are there any websites that you can maybe have Kelly list for us later that gives great examples of how to talk to your doctor, how to bring a caregiver in with you? Do you have some websites maybe that we can get from you and that Kelly can post on Facebook for those types of questions?
Yes, definitely. Well, Estelle actually introduced me to My Patient Rights, which talks a lot about healthcare coverage. I don't know if there's some others, like if other larger organizations specifically had it, but this is where I am encouraging all of us as patient-led organizations to come up with this content. Maybe we can have a roundtable discussion offline where we can create more content that we can share. I would love to work on that with everyone here.
That sounds great, because a lot of, leading into Estelle here, thank you for saying that, some folks were mentioning in some of the pre-questions that were sent was like, they feel like their doctors don't explain things in a way that they understand. And you pointed out so many great tips and resources, such as you, in terms of following up on that, bringing somebody with you. That's so important. And thank you for mentioning Estelle, because that's a great segue into what you're talking about and me introducing Estelle. So I'm having the honor to introduce Estelle Mata. She's going to be our next advocate that's speaking. And Estelle, if she's right here on the screen here, Estelle has been working in the healthcare industry for over 28 years. She's the president and co-founder of Lupus for Lupus, a nonprofit organization that provides support to those living with lupus overlapping conditions like we're talking about right now, their caregivers and loved ones. Estelle, alongside her sister Juana, have been providing support via in-person and virtual support groups, alongside listening to what Melissa mentioned and being a health coach. But Estelle is a member of the Lupus Multicultural Task Force. I love her accent also. For Lupus Research Alliance. She's a member of Lupus Patient Advocacy Council members for Lupus LA, and she's an active participant in the 32nd District of Mental Health Consortium led by Congresswoman, and I'm probably going to chop up this name here, Napolitano, and Estella can correct me on that, and is a board member for the Lupus and Allied Diseases Association. You're busy, Estella. Estella has a bachelor's degree in business management with an emphasis in IT. She lives in Baldwin Park, California with her husband and her lovely 2 daughters. So we definitely welcome Estella and all this great, rich experience as she introduces herself and presents her presentation to us today.
Sorry, there goes the IT background.
That's okay, you're fine. We're excited to hear from you.
I have to start by unmuting myself. So I don't know if you can see my screen.
We can see you.
Perfect. Okay, so I'm going to go ahead and get started today. I am so excited to be here. Thank you, Kelly, and thank you, Helena, for the wonderful introduction. One of the things that we started doing, my sister and I, is, advocating for those that live with lupus and overlapping conditions such as fibromyalgia. I myself have been living with fibromyalgia for a long time, but I recently got my diagnosis 3 years ago. So I'm going to go ahead and get started. We all started this because my sister was diagnosed with lupus in 2009. She almost lost her life and went into a very bad depression. And we didn't know what depression was. She didn't know what depression was, but she started illuminating. And hence why we started incorporating a lot of the art therapy into our support groups. And we knew it wasn't just something that affects the person that lives with a condition, but also their loved ones and their families. So here's a picture of my sister and I, and she's a social worker. She's amazing. We're both blessed to continue to work full time and also advocate for others. But going to what I'm going to be talking about here today, we're going to be kind of going over a couple of some lupus facts, fibromyalgia facts, and how these chronic conditions affect and impact our mental well-being and the importance of mental health and the importance of mental health in our physical health. We don't always talk about it. Not everyone's open to talking about and discussing their feelings, but it is very important not only to talk about it, to seek help, but to also take charge in doing so. And a couple of lupus facts, lupus is an autoimmune disease. It can affect children, men and women. It affects mainly the minority groups, and 9 out of 10 are women, but it also affects men. And some of the issues, depending on the type of lupus that you have, there are 4 types of lupus. But if you have the one that my sister has, which is a systemic lupus, it can affect any organ in your body, including your brain, heart, lungs, joints. And then some associated symptoms, chronic pain, extreme fatigue, hair loss, physical impairments, cardiovascular disease, strokes, rashes, and trouble thinking or memory problems. And I have to just say, a lot of these symptoms mimic fibromyalgia, which is what I was diagnosed with. And for a long time, we didn't know that I had fibromyalgia. I just lived with chronic pain. And it took forever for me to get diagnosed. And usually for someone to get diagnosed with lupus, it takes approximately 6 years. However, there's a study that just came out that says that it takes now about 2 years. But if you have fibromyalgia or were diagnosed with fibromyalgia, it may take up to 7 years. So go figure. Some of the fibromyalgia facts are: fibromyalgia is a condition that causes pain all over the body, sleep problems, fatigue, and it's often emotional and mental distress. And adults with fibromyalgia are more than 3 times more likely to have depression. And I know a lot of us don't like to talk about depression, but I'm going to go over what depression is and why it's important. And then some, associated symptoms similar to lupus are the pain, the stiffness all over the body, the fatigue, depression, anxiety, sleep problems, thinking problems, and concentrating, headaches, and migraines. Mental health is as important as physical health, and I cannot emphasize that enough. Your mental and emotional well-being is essential for your overall health, and living with a chronic condition such as lupus or fibromyalgia or overlapping conditions does affect us. So people with chronic medical conditions are at a higher risk of depression, according to the National Institute of Health. And all of this can lead into clinical depression. All the factors that, I listed earlier, the emotional drain, the stress of having a condition and having something to live with now that you didn't have, losing who you were and now becoming a new you with this condition that can affect your economic, well-being. You may lose your job, be on complete disability. You may not be able to do or function the way you used to, go to social events. The medications that you're taking may impact the way you feel and or cause depression. Your organs, maybe your organs are being attacked and you have to go through dialysis and you're overdrained and strained. Maybe your chronic pain is so debilitating that you can't even get up and bathe or get out of bed. So, and just simply knowing that you have lupus and knowing that there is no cure can just be overwhelming and stressful. So what is depression? What is this thing that we're talking about? Depression is a feeling of sadness, loss of interest. It affects how you feel, how you think, how you behave. It is having trouble doing the normal day-to-day activities. And the one thing I'm going to go over is what are the symptoms of depression, so you can look out for, so you can then talk to your provider and have them screen you professionally for depression. Some of the symptoms of depression are sadness, if you're feeling anxious, irritable, tired, maybe you're feeling guilty, you're feeling worthless, helpless, easily frustrated. Maybe you're having trouble sleeping, concentrating, maybe you're eating more, eating less, maybe you're experiencing a lot more pain than before, a lot more headaches, stomach problems, thinking about hurting yourself, and or suicide ideation. These are very, very important, and look out for those. Maybe make a list and ask yourself, is this how I'm feeling? And if you are feeling some of these things, again, you seek professional help. You go to your doctor, you get assessed, and you get screened, because a lot of insurances do cover mental health therapy, and it's okay to not be okay.
So Stella, would you say one of our questions are, does fibromyalgia cause anger? So would you say, could you give us a little example as you're going into the tips between that depression and anger?
Yes, well, I'll tell you, I think one of the things is feeling angry is one of the feelings that you're going to go through. So you're going to go through several phases and stages, right? So you're angry because you don't want to accept this. Why me? You have this why me mentality. Why is this happening to me? You're upset at the fact that you can't really do much about your condition. So you have to go through these grieving stages, and it's okay to be angry and it's okay to be upset, but knowing the difference of if you're in that stage for a prolonged amount of time is understanding that it is not okay to stay there. You need to seek help. And like I said, it's okay not to be okay. If you're angry, it's okay to be angry, but then let's move on to the next stage. You have several stages of grief, which that's another great thing to probably talk about and focus on, so we know what the stages are. But once you're dealing with some sort of issues, it's good for you to start practicing self-care. And here are a couple of self-care tips that I'm providing. You attend support groups, get together with people that know and understand what you're going through, practice stress relieving techniques. For me, breathing techniques have helped me a lot. It helps me release my my anxiety. It also helps me kind of calm myself down in my brain, because I talk a lot and my brain doesn't stop. And in order for me to sleep, I need to shut my mind off. So I do that. Mindfulness, you know, a lot of art therapy, yoga, Tai Chi, and not yoga is not for everyone. It's not for me. I can tell you that, but you can practice different modalities. Meditation, you could craft, you know, loom knitting, art therapy, all these things you can practice. So we have, you know, here are some pictures of the things that we've done in our support group. It is amazing to get your mind off something and to focus on what you're doing or the activity that you're creating, because it helps you be mindful and present in that moment. And I cannot emphasize enough, if you guys have if you guys can, take a screenshot with your picture of these numbers. These numbers are so important. If you are feeling suicidal, if you're feeling very, very depressed and you need immediate help, obviously you can call 911. You have the National Suicide Prevention Hotlines. You have them in English and in Spanish. You can text as well if you don't want to talk to someone. You know, right now with all the stress that we're dealing with, there's so much domestic violence going on. And so these are all numbers that you guys can reach out to. You are not alone. I want you guys to know that. Here are some amazing numbers. So if you guys, I'll leave that on for a little bit so you guys can see and take a screenshot of these numbers.
And while they're taking a screenshot, Estelle, and you're talking about, which is really great. Thank you for mentioning that, you know, those who want to, even for Spanish speaking, can actually contact some of these hotlines also. While we're giving them a chance to kind of look at those and write a little bit of that information down, which I'm quite sure Kelly will definitely repost some information. Could you also talk about thyroid issues with fibromyalgia, and, you know, could those thyroid issues even push towards depression on top of all of this?
Yes, there's actually, you know, there was not long ago, there was this conference about how it affects, everything affects, and the inflammation can trigger things. So yes, thyroid issues. And here's the thing, if anything you want to do, the one tip that I tell you is you go to your doctor, you get screening for everything. Any new symptom that you're feeling, you know, like Melissa was talking about the health literacy, you make sure that you understand every single thing that you are feeling and kind of figure out what is making this you feel this certain way. Could it be an overlapping condition? Could it be a thyroid issue? Is this what's causing you to feel angry, to feel depressed, etc.? These are all things that you need to, as a patient, take charge and ask your provider. I'm no expert, you know, I'm a patient advocate. I know that one thing that I can tell you is you document every single thing that you're feeling and you prepare for those doctor visits and make sure that your questions are addressed when you go see your doctor. And 15 minutes will not be able to give you all the answers that you want. But if you go ahead and you focus on that specific visit for that specific topic, I encourage you guys to do that.
Well, and as we lead out, thank you so much, because I know you're going to share your information. And as you're allowing folks to see your information right now and share your website, and I'll let you mention that, I have another question for you. So let me let you mention your contact information, and I'll present that next question.
Yes. So if you or anyone or your loved one are living with fibromyalgia or lupus or overlapping conditions, such as like mental health or dealing with anything, you guys can please reach out to us. We are a small nonprofit. However, we collaborate, we work with other organizations, and we just want you to know that you are not alone.
Awesome. Thank you. And giving them a chance to write that information down. Someone mentioned that one of the questions and statements were that they know that their physical health and their mental health coincides, but they don't feel like their doctors spend enough time addressing that concern. They don't feel like the doctors spend a lot of time, as much time addressing that concern. So what would you suggest in bringing this up when you have so little time with the doctors in the first place?
This is where you as a patient have to be in control of in the driver's seat. So when you go in to see your doctor, obviously you're going to have a list of things that you're going to discuss. They usually focus on the top 1 to 2 things. So if you're obviously coming in and saying you have heart issues or you're having palpitations, which that should be the priority. But if you're also feeling, anxious or depressed, you want to make sure you highlight that and you let them know, like, the purpose of my visit today here is to address my depression and how I'm feeling. That will get the provider to address that specific thing. And obviously, you don't have enough time, the 15 minutes, but make sure that you get the referrals. Make sure that you follow up and you ensure that the provider knows that this is something concerning. Empowering the patient is probably the number one thing. If you don't take charge, no one will. The provider is there to help you, and they have so many patients. So you need to advocate for yourself and say, this is what's important to me right now. My mental health is important. Therefore, we're going to be addressing that today.
That's great. That is great. And this helps leads as we get into our other speaker. You guys got so much great information as we're all uniting here for a purpose when it comes to autoimmune and musculoskeletal patients. This could lead into a question that I could bring Kevin in here for our next speaker that's going to come up. You're mentioning that mental health and how important it is, and depression can cause all of this anger. But one of the other questions is from one of our listeners is, what do we do? What do we do when it's giving us all kinds of side effects and affecting our self-esteem? Yes, we have the hotlines. Yes, we have people to talk to, but do you have any other tips or suggestions when something like this really does lower your self-esteem?
Yes, I think connecting with others and having others. Earlier, we had our support group. And one of the things that, always brings me so much, joy is to see how someone that's newly diagnosed with someone that has been living with a condition for such a long time can just meet and just kick off a wonderful support system, because you understand each other, you understand what you're going through. And yes, if you're not, you're feeling down, and I just had the fibro fog. The question, this is where this is real. I didn't practice this, but the question again, am I answering the question? I don't know if I answered the question.
You are answering the question. You were
Okay.
definitely leading into it, because we're talking about thank you for that great example also. That's why we're all here together. This empowers all of us to see that it happens. It happens. Even in our advocacy, it happens. But the self-esteem part, self-esteem part of the anger and the depression and how it happens.
Yes, your self-esteem, a lot of things that you can do. For me, I'll tell you what helps me. Getting up in the morning, using positive affirmations, having a positive attitude, and I get criticized for this because they're like, you can't be so positive and still, continue thriving, because it's not how it is. It's not the real life. But guess what? There's been studies that do indicate that if you think positive, it actually helps with your self-esteem. It helps you out. For me, getting up in the morning, positive affirmations, being grateful, talking about how grateful I am about getting up, being able to breathe, and also just putting my makeup on, to be honest with you, that helps my self-esteem. It makes me feel good. I don't put it on for anyone else. I'm like Kelly, I do it for me. It makes me feel good. So I will be chronically fabulous, every morning if I can. That's the first thing that I do, is I put my makeup on.
Right.
I love that, being chronically fabulous. And as Melissa said, she biohacked her way to being positive. Like, you know what? I'm going to figure this out. We're going to figure this out. And it does. And I think with that peer, our patients that are talking about is, having someone help them and empower them to say, you know what? Come on, move out the way. I'm going to make this happen. And you said that. Melissa has stated that. And Kelly is bringing us together to unite and empower folks and let everyone know from across. I don't know if folks really understand that we're on all different sides of the country presenting right now. So this doesn't happen just in your home. It's happening everywhere. And you stating that and having those hotlines, and Melissa stating that information and having information available is saying that It's out there. We've got to be willing to do that for ourselves. So yes, thank you so much for that. That's really great. So, and speaking of empowering, and we're going to bring us all back together, I'm going to mention our next presenter to help empower us even more. So Kevin's going to be here with us. Yay. Kevin's amongst all these ladies here today. How awesome is that? Kevin was diagnosed with juvenile rheumatoid arthritis at the age of 10. So we have to think about that. Being a male, or can I say boy at that time, at the age of 10, I think I can say that, me being a teacher. But at the age of 10, he was diagnosed with juvenile rheumatoid arthritis. He spent the first 15 years after his diagnosis not connecting with others. Think about that. With JRA, with junior rheumatoid arthritis, during his childhood and his early young adulthood. This created emotional issues such as isolation, self-doubt, and major self-esteem problems. Going to his first support group at the age of 25, Kevin mentioned, was life-changing for him. He witnessed for the first time how empowering meeting others can be. This experience started him down a new path, a path of being a patient advocate and connecting with the community and others. And for the past 27 years, wow, Kevin, 27 years, he's dedicated his life to being an educator and a connector within the arthritis community. Please welcome Kevin as he introduces his background and information to us.
Well, thank you so much, Helena, and thank you, Kelly, for putting this on. I'm just completely honored to be here today with such an amazing group. As said, I'm a lifetime patient advocate, and I wanted to share a little bit about my patient journey and how it may help you to start connecting with others and even start thinking about how you can start helping others as well. I also wanted to add that I know most people on this call are adult onset or even newly diagnosed, and I hope me discussing my journey, especially as a child, will help everyone, no matter where you're at on your journey. Over the years, I've met hundreds of people from all over the world, diagnosed with different diseases at all ages. I personally feel that despite my difficulties I had growing up with it, I feel glad I got it when I did. I was able to adapt my hobbies, my relationships, my career, and actually my whole world around it. I didn't have to deal with having an invisible disease like many people on this call, which I'll talk a little bit more about later. But back before I was diagnosed, I was a very athletic kid. I was the king of dodgeball, not to brag, and also the two-story rope climb. The trigger of my JRA was a result of a physical and emotional trauma at the age of 10. Soon after that, the ring finger on my right hand started swelling, and my pediatrician diagnosed me with, it's a fluky thing, and it will go away. Well, after a month at a teaching hospital in Boston, due to the lack of treatments at that time and a very aggressive onset, both my wrists were naturally fused, as well as my left elbow, and my knees, neck, and ankles were well on their way. In my teenage years, the physical pain was bad, as mentioned, but not nearly as bad as my emotional pain. I felt like I was the only person in the world with this, and my knees could not straighten past 20 degrees, so every step I took, my knees weren't bending, causing a very bad limp, making something as small as a crack on the sidewalk an obstacle. So even into my 20s, my self-esteem and body image issues were my biggest problems easily. It was so bad that I would not look people in the eyes when I spoke to them because I thought my words were meaningless, and I could hardly look at myself in the mirror because I hated my body for betraying me. I went into the computer field after high school, and I made some really good friends, but never felt like I felt like there was a part of my life missing, almost like I was slightly out of phase with everyone else in the world, only later to find out that I felt that way because of that one thing, and that was not knowing anybody else my age with my shared life experience. I worked in the computer field till my mid-20s, and by the end, I was doing one of only three things: working, eating, or sleeping. The fatigue and pain made working unbearable, but I was very lucky back then to get on long-term disability and Social Security income on the first try. At that point, it was a very difficult time losing most of my work friends, and it felt leaving me feeling like I didn't have much of a purpose anymore. And easily it was the lowest point of my life. And it was then I visited my local Arthritis Foundation office, which was outside of Boston, and I told a very nice volunteer about my journey. And looking back, I think it was the first time telling a complete stranger how difficult it was for me living with an autoimmune disease. And by the end of our short conversation, I remember asking her, okay, you know my story now. What can you do for me? Which makes me laugh looking back. So she provided me details of their young adults arthritis support group, which was actually meeting the next night. So it took all I have to leave my car and walk into that room, and just thinking that it would just end up in disappointment like so much other things in my life. And I could not have been more wrong. I walked in, I saw the facilitator. She was my age. She had similar joint deformities as mine, but unlike me, who was angry and riddled with self-doubt, she was joyful, she was confident, and she was beautiful. That group on that one evening taught me that having an autoimmune disease didn't have to ruin your life. It's just something that you happen to have. So that impact of that group was life-changing. Soon after that, my 8-person network turned into a 30-person network when I attended my first Arthritis Foundation National Conference in Philadelphia. All of my new support system was around my age, but more importantly, for the first time, I didn't have to explain why I felt good yesterday and why I don't feel good today, or why I'm wearing a splint, or why I have a limp. I was just accepted for the person I was. And also, I no longer felt out of place with my existing friends and family. And that power of having understanding support is what brings me to talking to you guys today. With the new empowerment I felt in my life, I soon moved out of my parents' house in Massachusetts and headed to Arizona, where I started giving back to the community as an Arthritis Foundation committee member of a local event. I was a camp counselor, and I started writing for the local chapter newsletter. And it wasn't long before I was noticed by the national office in Atlanta. I became a contributor writer to a quarterly newsletter geared towards parents who have kids with juvenile arthritis. And I also sat on a couple of national volunteer committees as well. And during that time, I increased my network of support and started learning about nonprofit management, which led to some significant personal self-growth. So after a couple of years in Arizona, I went back to Boston and had bilateral knee replacements. And I think some of you understand this. For me, it felt like the right time. But it was a different world back then. I was able to spend 1 week in the hospital and 3 weeks in rehab, recovering. So after that month, I was able to do steps, step over step without a banister for the first time in 15 years. And due to my improved posture, I actually grew 3 inches, which was weird going home because all the doorknobs were really low. So I flew back to Arizona a week later without the need of an assistive device. Don't think I could do that nowadays. I continued to attend local and national conference and volunteer for the Arthritis Foundation and other nonprofits for 8 years, managing my own support group and helping others do the same, and getting to see time and time again the awesome power and impact of these connections in our community. So the simple formula of just bringing people together led me to create my own 501c3 in 2001 called Arthritis Introspective. Our mission was to help centralize the network of existing autoimmune support groups around the country, as well as give people the tools that they need to run groups in their community. And we also had a national conference, National Education and Social Conference once a year. And with the help of an amazing board of directors and volunteers over the course of those 10 years, we helped make thousands of connections and understanding friendships. Many of them still are going strong to this day. So in January 2016, Arthritis Introspective merged with the Arthritis Foundation, and I became a staff person. And all of our programs became the base of the Arthritis Foundation Live Yes Arthritis Network. And I'm really proud to say we now have well over 100 local groups around the country, all of which are led by volunteers.
That is awesome. Would you say that some of the volunteers were the ones that you interviewed in your research? The research that I'm presenting there for you, that you're presenting right here, would you say that that was some of those volunteers in that particular abstract?
Oh, the slides coming up, those aren't my abstracts. Those are from the NIH website.
Okay, awesome.
I wish it was my abstracts and my studies. Yeah, no PhD here. Yeah, if you don't mind, Helena, if you want to bring up the first slide. Now that I've talked a little bit about myself, I want to talk a little bit about the science of
there you
others.
go. They're right there, and that's where we were. You were talking about your research. Awesome.
So slide one was done by a group of people over in the Netherlands, and it entitled "Empowering Processes and Outcomes of Participation in Online Support Groups for Patients with Breast Cancer, Arthritis, or Fibro." So in this particular one, they interviewed 23 participants of online support groups, and the analysis was part of the empowering process, exchanging information, encountering emotional support, finding recognition, sharing experiences, helping others, and of course, amusement. So it also mentioned is that disempowering processes were mentioned far less often. So empowering outcomes mentioned being better informed, feeling confident, relationships with their physicians, which is a great one, and their treatment and their social environment, improved acceptance of their disease, increased optimism and control, enhancing self-esteem and well-being and collective action. So the next one, please, Helena. Also from the Netherlands, same group, self-reported differences in empowering between lurkers and posters in online patient support groups. And I found this one very interesting. Again, breast cancer, fibro, and arthritis. And the objective was if lurkers in online patient support groups profit in the same extent as posters do. So in a questionnaire, they asked questions about demographics, health characteristics, and use of satisfaction in online support groups, empowering process, and empowering outcomes. And the online questionnaire was completed by over 500 people. 21% identified themselves as lurkers, which I never thought I would see in an abstract. So the conclusion revealed that participants in online support groups had the same profound effects on lurkers' self-reported feelings of being empowered in several areas as with the posters. And apparently reading, as in today, we have people listening and watching us today, its effect is significant to profit from participation in an online patient support group, whether you're a lurker or a participant.
Out of curiosity, Kevin, would you say, do you know if any of those numbers are broken down between male and female?
Unfortunately, that was not part of the study. I really wish it was. Yeah, that's a really good point. So
have you found many men willing to actually participate in a lot of the online support groups?
And
I guess I'm pointing out you're a male right now.
Yeah, that's fine. I've got the beard. In my personal experience, I think that some men, may be resistant to joining an online support group or even a face-to-face support group. But of course, I'm here to say that everybody can get benefit, whether it's online or in person. Awesome. Does that answer your question, Helena?
Yes, it does. Okay. Yes, awesome.
So one last slide. And this was a very interesting one. Which goes into the kind of my opinion about being glad when I got it when I did. And it's living with an invisible illness, social support experience of individuals with lupus. And the purpose of this study was to explore the nature and impact of social support from medical professionals and from support groups for individuals with lupus. And this was done by Lupus UK and Lupus Group of Ireland. 133 people participated, while 77% responded. So the conclusion, that findings suggest that individuals with lupus have mixed experiences in terms of contact with medical professionals and involvement with support groups. Furthermore, low public awareness of lupus appears to be a contributing factor, while contributing to feelings of invisibility for patients, leading to loneliness and isolation, as I think all of us have mentioned. So medical professionals might benefit from skill training in terms of managing the psychosocial consequences of lupus. So I found that part very encouraging. So the next slide, please. So what can you do to connect? We've already talked about it a little bit on this call, but you're doing it now, frankly, as a poster or a lurker. You are with us, you're watching, whether now or in the future. Yeah, if you're seeing one of these events for the first time, if you're newly diagnosed and you're hearing similar stories that resonate with you, I want to welcome you to the community. If you're not watching us live, or if you are watching us live, don't let this opportunity pass you by. If there's a post you like that resonates with you, send the person an IM. Say that you like their post, or ask them if they liked the event, or what they thought of Kevin's gray beard. Start a conversation. The more individuals connections we make with each other, the stronger we all are together, which has also been mentioned a couple of times. And also, there's plenty of social media groups out there to join and engage in. I also understand that many people don't want to join these types of groups due to privacy issues, but fortunately, there are still groups outside social media, which are often a lot more private. And also mentioned before, join a support group. Even during the time of COVID, having the opportunity to have direct engagement with others is important, especially if you were newly diagnosed, which again was mentioned. Also, I will have to say that not all support groups are the right fit for you as there may be times when you go to a group and you don't feel like you're getting benefit from it, and that's totally okay. There's plenty of groups out there. I've been in groups personally that I've walked out because it wasn't my scene. I've also facilitated groups and had people walk out. So that's also totally fine if they weren't getting the results they wanted from my particular group.
So would you say though, Kevin, you just mentioned what one of the viewers have actually asked. They mentioned that they've lived with chronic illnesses for many years privately, just as you have. Mm-hmm. And they were apprehensive about the support group. You mentioned mm-hmm. that. And they just didn't want a negative experience and felt depressed about it. Yeah. So you just mentioned that if the group doesn't work, walk out, it's okay. But would you have any other advice? Like, is it okay to even ask the support group leader? Should I get up enough nerve to ask the support group leader for another group that might work for me? What if I walk out and I feel like there's no other groups out there for me? What do you suggest?
There are always other groups out there. It's okay if the facilitator wants your feedback and they're willing to accept it, that's totally fine. Most of the time that it doesn't take long before you just think that, okay, this isn't the group for me. But there's a lot of opportunities, especially now with Zoom. So another thing is come back to events like this. Everybody on this call has regular events like this, and there's something going on every single day. So sign up for the emails, start following them on social media.
Well, you're quite popular, Kevin. So you got some great fans. I saw some fans that were saying that Kevin is great. And so that's awesome and encouraging.
Oh, stop it. Okay.
You are. So with that, one of the viewers mentioned that they have that it's a blessing to hear about men going to support groups. They have RA. One of the viewers have RA and said that it has helped them. It helped their wives. It helped their family members. I'm assuming I can also say, about where men have to be the one that's being taken care of, mm-hmm. or where men are the caretakers themselves. So I just wanted to let you know that you had some fans that were actually mentioning that, and a viewer that mentioned how having men come to support groups they've seen a difference in that.
That is fantastic to hear. And thanks, fans. A couple of more things is keep moving forward. And I've totally been guilty about this, even at where I'm at in my life. we sometimes settle for the connections we have, or we may think we don't need additional ones. And connections with new people, regardless of where you're at in your journey, gives us all an opportunity to continue to evolve and to improve our own patient journey. So it is
Kevin,
easy.
thank you.
Yes.
I'm sorry. Mhm.
Okay. And it's easy to forget the impact of a phone call, a video call, or just a postcard. Keep the people that are close in the community close to you, and do what you can to create, become stronger with them, because we're all in this together. So just really quickly on the
You
next
did it,
slide.
Kevin.
Okay.
Oops, I apologize, Kevin. You had that next slide there?
Just one more.
Okay,
And
no problem.
Just ways to give back, educate yourself and the opportunities in your community. Again, everyone on this call is affiliated with some sort of nonprofit, and we all have ways for people to get involved. The amount you want to give is totally up to you. Giving back, of course, as you've heard, is very empowering. And the more you volunteer, the more self-growth you may have as well. So yeah, don't be afraid to be yourself, or don't be afraid to do it yourself. If you're not finding the right fit for you, make your own way. Create something that not only will help the community, but will bring joy and satisfaction every time you do it. And always remember, if you just help one person in the community, you could change their lives forever. Just think about my first support group leader. So.
You just said it, Kevin, that if you could help one person in your community, you can change their lives forever. I think this is a great segue into getting Kelly back. So thank you so much for your story, Kevin, and your empowering and encouraging words. Kelly, I am passing it right back to you.
Thank you so much, Helena. Appreciate it. And I just want to say thank you to Melissa, thank you to Estelle, thank you to Kevin, and thank you again, Helena, for doing this and coming together. And thank you to all of you for joining us for AMP Up. This is hopefully one of many opportunities that we will be presenting to you through More Than Lupus, where we bring together spearheading and strong patient advocates to share their experiences to hopefully enhance the patient community. And if you have any questions or would like to contact someone regarding further information about the topics discussed today, please email me directly at Rosetta, and that's ROSETA.Kelly, KELLI, @gmail.com. Thank you again, and don't forget that your voice matters. Time to turn it up. Thanks, guys. Take care, and we'll see you soon. Bye-bye.